Western Australia's daily COVID-19 case tally has declined for a fourth straight day as the state looks to resume some private elective surgeries. WA Health on Monday reported 5,566 new infections, the lowest number in almost a week, and well down on the 7,151 cases registered on Thursday. Premier Mark McGowan said at the time WA was likely just a few days away from its Omicron outbreak peaking at around 10,000 daily cases. Chief Health Officer Andy Robertson has since indicated the peak in cases remains weeks away. WA's hospitalisation numbers are tracking in line with the health department's modelling, but fewer people than expected are in intensive care. Your cookie settings are preventing this third-party content from displaying. If you'd like to view this content, please adjust your cookie settings. To find out more about how we use cookies, please see our cookie guide. There are currently 163 people in hospital with the virus, including 4 in ICU. The modelling suggested there would be between 11 and 23 people in intensive care at this point in the outbreak. Camera Icon Chief Health Officer Andy Robertson has since indicated the peak in cases remains weeks away. Kelsey Reid of the West Australian. A quarter of people hospitalised with the virus in the first 2 weeks of March were unvaccinated, according to figures released by WA Health. Almost half of those hospitalised were aged under 40. A pause on elective surgeries at private hospitals that came into effect on Monday will now only last 48 hours, the government has announced. Health Minister Amber-Jade Sanderson said the freeze on non-urgent Category 2 and Category 3 procedures requiring an overnight stay had been reviewed in light of the relatively low COVID-19 hospitalisation numbers. She said WA's high vaccination rates were keeping people out of hospital. Camera Icon Amber-Jade Sanderson says a pause on WA private hospital elective surgeries will now last 48 hours. AAP. We have taken an agile and planned approach to elective surgery, and will ensure some patients who require surgery can be treated as we continue to review these settings, she said in a statement. An 8-week pause on non-urgent elective surgeries at public hospitals remains in place until May 9. The government is yet to say when it will ease Level 2 public health restrictions, including capacity limits at home gatherings and public venues. Mr. McGowan said upon introducing the rules, he was hopeful they could be unwound by the end of March.